management's a huge thing, and you need to be organized. Your work ethic definitely plays a role. If you're not a motivated person, you're going to have a hard time keeping up. However, if you're organized and you can juggle and be flexible as far as what your patient needs and tending to their needs at that present time, your day goes a lot easier. It's easier on the patient, it's easier on you. And I think one of the best things to make your day go smoothly is open communication with your patient, making sure that they are aware that you know when their med times are, and you specify if you're going to be right back, you actually come through and be right back. Being honest with them and proving you have a trusting relationship with your patient, you can time manage, and you're well organized and well motivated, patients really thrive. Family education is definitely key, educating them on why we're doing what we're doing, the purpose, our goals, and explaining maybe what the patient's going through in a simplified term versus like a clinical diagnosis.
And I would say being a nurse at Select Specialty Hospital, it can be an emotional roller coaster. And so it's important to keep your emotion in check. And I mean, one, you may have a patient that just passed away and you're over there hugging a family member, and then you walk into your next patient room, and you must keep a positive attitude just for your other patients. The toughest day can also be the most rewarding in a sense. I mean, you may come in and see a patient that's about to code or is on a critical drip, and they are deteriorating. At that time, I mean, this is where nursing is most crucial. You know, all that knowledge that you were able to learn, are you able to pull that and apply it to this situation? So you're there to comfort not only the patient but the family and everyone there. So the toughest days, even though they are overwhelming for sure, but you have to keep reminding yourself you are here for 12 hours, and in that 12-hour period you are here specifically for the patients.
If we don't operate as a team, we don't see as much success. Anywhere from getting a patient turned to performing wound care to performing the self-care for a patient, it takes a team. Usually we have respiratory therapy ourselves as nurses, and the aides, anything like that, it takes a team.